Hello friends, we have started this series. In today's video we will talk about the third month. In the third month, that is, 8 weeks are over and the 9th week has started. Third month means from the 9th week to the end of the 12th week because in 13 weeks your 4th month will start, which will be about a week before your due date. Because every month is not exactly 4 weeks, it is about 4.5 weeks long. So if you count in weeks, your third month starts as soon as you reach 9 weeks. At this time your baby has reached about 2 to 3 centimeters. Okay, understand that the baby has become 2 to 2.5 inches. Now what will come in that baby? Gradually, from the 9th week to the 12th week, changes will start coming in him. The character of a human being will develop in him. When your doctor will do your anti-scan, that is, nuchal thickening scan, which happens from the 11th week to the 14th week. Anti-scan is done between 11 and 14 weeks, so if you go around 12 to 13 weeks, then you have to tell your doctor to show me the baby. They will show you the baby. You will see a small human baby, that is, a human baby. His hands and legs are moving, his nose is visible, his eyes are visible. If you magnify and zoom in on it, it will look like a complete human. Okay, so by the 12th week, the baby gets all the characteristics that a human has. Initially it looks exactly like a tadpole. Initially, when the test is done in the 8th week or 7th week, it looks like a small louse, and the doctor says that this is a baby. You don't understand where the baby is, nothing is visible. Okay, now this baby is also getting small nails, small fingers are coming, both small hands, the one above the hand below, the forearm and the upper arm both are developing. Similarly, the legs above, the legs below the knees, his small feet are moving like this. You can also see his small soles and even the fingers of the feet, which we call toes, can also be seen moving slightly. So this child has developed the characteristics of a human being, because after seeing them we can say that it is a human child. Okay. Along with this, the eyes are getting bigger, the eyeballs are forming, I told you, the nails are forming, his small ears are also developing, the ears, that is, the earlobes, the pinna above them is also developing, which if there is a very big machine and you magnify it and show it to the doctor, you can see it. Now why do we do anti-scan? Anti-scan is done in 12th week and 13th week because basically we check the child with Down syndrome whether he has Down syndrome or not, because it is a very important factor. We measure the swelling of the child's neck or the nuchal thickening at the back, which is edema of the neck and all cuteness tissue. And its criteria should be less than 2.5 millimeters. There are different criteria from 2.3 to 2.5, but the maximum should not be more than 2.5. Along with this, because the child's nose has also started forming, so this nasal bone, we measure it, we do not measure it, we see whether it is visible or not. So in many sonography, the doctor says that the nasal bone of the child is not visible, that is, it has not ossified, ossification. That is, there is no also to see the bone, its ossification in sonography is necessary in X-ray. Calcium deposition is necessary in it. So until calcium is deposited, until the bone is ossified, it will not appear white in sonography in X-ray. So when it is not visible, that is, it has not ossified and the doctor says that it is absent or is not visible, then the suspicion of Down syndrome arises somewhere. So at that time, your double marker, triple marker or quadruple marker sonography test, which is called big sonography, is done. Depending on how many weeks you are at that time. If you are in the 12th week, quadruple and triple markers are after 16 weeks. Double marker is there before 12 weeks. So it all depends on what your finding is at that time, what is your age, and along with that, what is the thickness of your nuchal thickening, which is NT scan. So, these are some parameters that are done in the 3rd trimester. I have told you about the changes in the baby. The changes in you are going to be the same as in the 1st and 2nd months. You may increase a little more. Vomiting may increase a little because your hormone HCG hormone has increased a little more. However, now it gradually comes to a plateau level. After the 8th week, the HCG hormone starts going down and your vomiting starts reducing a little. The frequent urge to urinate will still remain because the baby is still inside the pelvis. Inside the bone. It has not come inside the stomach yet. So, when it comes inside the stomach, then your stomach will be visible. The thin ladies do not feel that they are pregnant for 3 months. From the 4th or 5th month, their stomach comes out a little. So, in this month also you will feel tired. The changes that I told you about, small tubercles appear inside your breasts which are visible on your breasts. The area around the nipple is called the areola. The blackish area inside it increases a little.